Right, well, we'll get started. Thank you very much for coming. My name's Adam Caldwells. I'm the Chief Officer for the Aberdeenshire Health and Social Care Partnership. And I'm going to run us through a few slides, and then we're going to split up into smaller groups, do a bit of work in smaller groups, and then do a little bit together at the end. So, sorry, I need to just let you know. So, Stuart is filming this tonight. Apparently none of you are going to appear in the film, it's just me, so that people that couldn't come can see it. So just as you know, that's the camera behind. So what's the purpose of today? So who came to an event in March? Who's a few people? Great. So this is the follow-on, so it's a little bit later than we thought. And who that was here in March has brought someone with them? So do you remember that was my challenge at the end, was to bring someone else? So one word. Okay, that's the first success we've had of the series so far. So thank you very much. Well done, well done, well done. So when we met you in March, we were trying to get a view from the public about what we might do around our strategic planning, our intent over the next few years, and that was to go alongside some input from staff, so from different professional groups, alongside the view of the public. So, sorry, I've forgotten my pointer. I do apologise. I'm going to have to keep wandering up and down, so forgive me for that. So we've developed the draft Aberdeenshire Strategic Plan. Perhaps some of you might have seen that. Doesn't matter if you haven't. We're going to run through some key things from that. And what we want to check tonight really is what you told us reflected in the plan. So we want to just have that common sense check that what you thought was important is in the plan and has got an appropriate amount of priority. And we've got a real chance to change that. So if we've got it wrong, we can make changes to that. And that plan sets out what we're going to do over the next about 3 years. That's the plan, a 3-year planning cycle. So just a couple of slides for people that weren't here in March, just a really quick reminder about 2 real key drivers for change. So why is it we need to change what we're doing? This first graph is about our population and how the population is made up. So running up this axis, we've got the number of people, and this is about 200,000 here. Our population is about 250,000 in Aberdeenshire. What we've got in the graph is 2 different bits. This is our population at the moment, who are aged 0 to 64 years. So from birth to normal retirement age at the moment. And what we've got over here is people of normal retirement age and older. And we've got the population just now in this light green colour. And then in the dark green, we've got the population that we expect to have. So obviously we don't know, but this is our projection for the population in about 20 years' time. And what we can see here is that the birth to through working age population is going to change a little bit, about a 5% increase in the population of working age. And in the population who are normal retirement age and older, we're going to see a really, really big increase in that population, about 65% increase. And in terms of the context of that, within that population, people who are over 75 will make up half of that population. Okay, so within that bigger expanded group, and it's about, I think it's, I can't quite remember, 64 or 65,000 people, about half of those will be over 75 years of age. So an incredible change from what we've got at the moment. And what does this mean? So in terms of this graph, we've got what we've got today, and this is what we're going to have in 20 years' time. What we've got today is... sorry, it's quite all right. It's quite all right. So what we've got today is... this is money. We're just using money because it's a really easy measure, not because it's better or worse than any other measure. It's just easier to see very quickly. So what we've got here is money that we spend through the council at the moment, so typically through our social services budget, and money we've got here that we spend through the NHS budget, and that's both in the community and Aberdeenshire residents who go into an acute hospital, so who go into Forester Hill to receive service there. So what you can see is we spend a huge amount of money. We spend about £350 million a year on the residents of Aberdeenshire. And we've got a kind of an age makeup here. So in the NHS, there's a little bit more than half is spent in the working age group. And in social care services, it's about half and half between that older and younger group we spoke about. What we've got on the right-hand side is the projection if we go forward 20 years. And the really important thing to notice here is this is what we expect in 20 years' time if we keep doing the service as we do it today. So if we didn't change anything and we just do what we do and we keep doing it over the next 20 years. The population's changed and the impact that has is really, really profound. So the proportions of spend on younger and older change, that doesn't matter in my mind at all. But the really important thing is we would need, for our population, about another £110 million a year. So we spend about £350 million a year at the moment. We'd need a third of that again. Now, if you think about our context financially, we're still in a time of austerity. We're certainly not seeing increases at that scale, and that's about 8% year on year increase. So most operational budgets are having to trim back by a few percent a year to meet the normal inflationary increase. Okay, so that feels to me as something pretty unlikely that's going to happen. And I'm not going to go into it today, but in March I explained beyond that even if we got the money, we're unlikely to be able to employ enough people to do the work in the way we do it today. So we wouldn't have enough trained people as doctors, nurses, social workers. We probably wouldn't have enough carers and all those things. So just doing what we do today, even putting money to it, probably doesn't get us to that next step that we need to do as a society and as a system. So we need to do something differently. And those are some of the key drivers for thinking about how we plan our strategy, over sort of 10 years, 20 years. And what we've got out today is what we'll do over the first step of that. So, when we met you in March, we spoke about all sorts of things, and we're going to talk to you today about really three themes. So we've taken what everyone said, and we think three themes capture what we need to do together. And I'm going to run through each one of those as 3 slides in a minute. And they're this idea of partners in health, the best of health for everyone, and effective treatment and care. And as I say, there's a slide for each of those. Just want to give you a bit more navigation. So, what we need to do as a health and social care partnership is deliver 9 outcomes which have been given to us by the government. So the government have said, we expect you to deliver 9 particular things. I was looking optimistically that they'd be on the wall, they are. So these are the 9 national outcomes, and as we move around you can perhaps get a minute to cast your eye over them, get a feel for what they are. I'll just talk about a couple. So outcome 1 is that people are able to look after and improve their own health and live in good health for longer. So difficult to disagree with that, that's a pretty good outcome. It's a very big scale outcome, so the things we need to do under that to measure it are quite a lot of work. And another one here, people who use health and social care services are safe from harm, so that whole idea of patient and user safety, patient safety, really, really important. This one, health and social care services contribute to reducing health inequalities. Again, absolutely what everyone thinks is really important, that idea of the gap between people in their health outcomes. So there's 9 of those, and perhaps you can have a quick look at them. So we have to do that. That's how we'll get judged by the government, is this idea of 9 national outcomes. What we've got is these 3 themes that I'm going to talk about. And the other little bit of navigation, and you're doing this in as we break up into smaller groups, is we've got 14 key initiatives which we think describe us through these headings. So just trying to think about the idea, we've got kind of levels of work, we've got the 3 high levels and 14 things that support these. And if we do those things, we believe we'll nail these 9 outcomes. Sorry, that sounds really quite confusing. Hopefully it will make more sense when you've got a bit of paper in front of you in a minute. So, I'm going to run through the three things now. So this first one is this idea of partners in health and care. So what does that mean? So we spoke a lot in March about this idea of really changing community, and it sounds desperately grandiose and it's not meant to, but we're at a moment in my mind where we're trying to really change part of our society and social construct. We need to change to a different way of doing things together. And at March, people absolutely could see that. So the people we spoke to across Aberdeenshire, we spoke to about 350 people, can absolutely relate to that and had a number of things that we needed to do. So community key role in that top one, this idea of how people live better and more healthily and take a different responsibility around their well-being and health. Communities recognised a huge number of assets. So again, if you those that were here, if you remember, we asked about what was the asset base, this idea that we turn around from saying what's all the things we can't do and what's wrong with everyone, to actually what's really good about things we do, what things do we already have that contribute to what we're doing, and what are all the really good health things that allow people to do things well. So trying to turn the paradigm upside down. And there was lots and lots about some physical stuff, so people identified all sorts of venues that were really key to communities across Aberdeenshire. People spoke about clubs and groups and services that people did on a voluntary basis that complemented and worked alongside some of the statutory stuff that we do as a partnership organisation. There was a real key recognition that actually just our people are our biggest asset, and actually our communities have a huge number of skills and a huge number of things that people give, to society and to community. We had, I think transport was mentioned, I think almost everywhere, I think everywhere, and the sense that we live in this huge rural place, and actually getting around is one of our real challenges. So one of the key things we need to think about how we work with others to improve that. The next one is really a little bit of what this is about, is starting to try and have a different relationship with communities and with the public, so that as we move forward, decisions about what we do aren't made over there somewhere in some remote office. They're actually part of what we do together, and we struggle with the same stuff. So when we've got a constrained resource, how do we make the best use of that, as well as when we've got different and exciting things to do, how do we do that together and think about prioritisation? And that's, I guess, the thrust of the strategic plan, is how do we work together to decide what we want to do together. And there's a real keenness on that. And again, this sort of idea of not being tokenistic. So I think the process we're in at the moment is really just the beginning of I hope, a new way to do it. So again, what we've been doing with these events is fairly traditional. It's an event, someone's talking, we're sat together, we're going to break up the group. What we're trying to start building as we get more capacity is how do we meet people on their own terms? So rather than us saying, we've got an event now, how do we actually have people that work in the community coming out to the lunch club, the mother and toddlers group, working with people in sheltered housing and residential care in their own homes. So meeting people on their own terms rather than this rather traditional way we're doing that. But we're at the start of something, so we're kind of aware of where we want to get to. And then a key role for the voluntary sector. So how we wrap that up. And there's two really key bits of the voluntary sector. There's our big national organisations who do work right across Scotland, and they've got a really key role working alongside us and do lots of things that statutory providers do, as well as other things. And then we've got the other bit, which is really local groups. So a group you might easily have here in Ellen, or Pitmedden, or something just nearby, that's really got an interest in their own community and what they do there. And how do we work alongside both small groups and great big national groups to help support what we do in a joined up way? Okay, so that's the first one, partners in health. So something about changing that way we work together. The next bit was the best of health for everyone. There was a key thing about, I guess partly driven by the slides on the demographic change, and we spoke quite a bit about that in March. and the sense that actually an ageing population has lots and lots of really positive things about it, and how do we build on that? And anyone see, there was a survey published last week, a European survey, did anyone see that, about how we get on this? It was UK was counted as a single, Scotland wasn't split up. But we as a United Kingdom finished, I think, in the top, I think it was the top 6 or 7 around support for older people on national frameworks. So the idea of having good pension provision and other fairly what we've got in our country, statutory level things. We're really, really good. We were almost at the bottom about how we support older people for social isolation. So we were almost at the bottom of the whole of Europe for that. So again, we've got some really great things and some things we need to fundamentally change as to how we do them. So that top bit, really, really, really important. Something about taking responsibility differently for our own health. So again, we are so absolutely everyone knew we shouldn't really be smoking anymore. We shouldn't really be drinking too much. We need to exercise and we shouldn't be obese. So pretty much to a person we all know that, but we still have a little bit of a gap as to how we behave. So there's something about how do we exercise regularly. So how do we support people in a community setting to make some of that difference? There's 2 things here. If we look at big public health change, that's most effective when it comes from legislation. So if we keep putting the price of fags up, less and less people smoke. That absolutely works. But if you're a smoker and you want to stop smoking, how do we support you locally to be able to do that as well as you can? So two different bits. Big policy bit makes a big difference, but if someone wants to change, how do we work with people to let that be as successful as it's likely to be? And then I think the last points, I kind of picked up on the third point there, that there was something really key about this idea of well-being, and how do we look much more than little bits of a person, but in a holistic way about well-being. And again, there was lots of talk about things like isolation, having a different sense of society and community, and how do we achieve those things? Because actually, if we get those right, we have much, much better outcomes around health and well-being more generally. And I think everyone knows that and was expressing that very clearly in March. And the final thing was, I guess, the bit that's left for us as a statutory provider. So if those bits are working well and someone then becomes ill and they need support of health and social care, how do we do that, and how do we do that well? And you told us that there were really 5 key things for us to work around. In my mind, if we concentrate really, really heavily on this one in the middle, this idea of person-centred care, we'll actually achieve the biggest step forward and allow the other things to fall out. So that idea that when we're working with an individual, be they at a health end or a care end or anywhere on that spectrum in between, how do we work with the person, not on them? When we're working with someone, how do we get their aims and aspirations to be at the very centre of how we develop a plan together about how we can support someone and how they can support themselves? And if we get that right, then I think we make a huge difference. And part of the challenge for that is, how do we make the systems change so that our staff can work alongside our population in that way? If we do that, most of the other stuff starts to fall out of that. Okay, so that was what we heard in March. What we're now going to do is test out whether that's right, and we're going to split up in a second. So the first thing we've got is a video, just lasts about 4 or 5 minutes, and that's trying to give a few examples about what we think those things mean. So they're just kind of illustrative, trying to demonstrate what that might mean for us in very tangible terms. I'm hoping I'm going to just press that button and it'll start. So here goes.
We recognise that health and social care services have to change. Even though in Aberdeenshire we're relatively fit and healthy, we still rely a great deal on both of these services. We expect the number of older people and individuals who need support in terms of their social care and their health to increase. But our budgets and staffing numbers won't increase at the same rate, so we're moving forward with integration. We're much clearer now about what this will mean for residents, staff, and people who need health and social care. It's our intention that services will be available more locally. Staff from both sectors will work together as a single team, and everyone will make much better use of the facilities and support groups that are available. So, what does partners in health and social care mean to you?
When I was first diagnosed with serious breathing problems, emphysema, I was really afraid and searched for help and advice. My GP and hospital consultant told me about medicines and so on, but I didn't feel included in the decisions about my treatment. I just felt that the illness and the professionals were taking over my life. But now I'm working with them, I know a bit more and understand how to manage my own symptoms, so I feel like I'm in control.
My daughter and I used to do a lot together, mostly the things that aren't that much fun. I'd take her for endless appointments and sit in waiting rooms. Most mornings the minibus would pick her up and take her to the day centre, and if the centre was closed, I'd have to take a day off work. The people there were the only friends she had, really, but two big things happened. Instead of going to the day centre, she goes with her support worker to her job at the garden centre. We're hoping that over the next few months she'll start to go on her own. And she goes to the jazzercise class with my neighbour's daughter. No one minds if she doesn't get the steps right. The fact that she has Down syndrome isn't what defines her nowadays. She's a friend, a colleague, someone you see in the local supermarket, just like anyone else. I love looking after my daughter, but now I've got time for me as well.
What does the best of health and care for everyone mean to you?
I try to keep as well as I can, walking wherever I can rather than taking the car, and watching my weight. When I get colds, coughs and the likes, I go to my local pharmacy. They're really good with advice and information. I don't need an appointment either. My mum and dad relied on the doctor much more than I do. Mind you, when I felt really stressed last year, really down, I did go to my GP. She said that exercise would do me more good than a course of pills, and so far it's working for me.
I am looking forward to a healthy and active retirement. Keeping well for me means keeping busy, so I'm going to be a volunteer. I used to be a nurse, so something like befriending might suit me, or I may decide to do something quite different, like helping someone tidy up their garden. It would be fun for me, and I'd be giving something back to the community. It's a win-win.
I don't manage nearly as well as I used to, so a couple of years ago I looked around to see what choices I've got for a more suitable house. It's the best move I ever made, and I'm sure it was a big factor in getting me home from hospital right after my operation. It's my decision and my life, and I'm going to be as well prepared as I can be. It's my responsibility, my future.
What does effective treatment and care mean to you?
I really like having the doctor, the occupational therapist and the social work people working as a team. It means I don't have to keep repeating my story every time. And when I fell last winter and thought I'd broken my arm, I didn't have to go into Aberdeen for an X-ray. I was taken to the local hospital and treated there. I was back safe in my own home the same day. I needed some help with washing and dressing for a few months, but because I was at home, the care manager could talk this through with my daughter and I. The home carer encouraged me to do as much as possible, and I got back to my old self sooner than I thought.
My GP practice wanted to get as many of his patients and staff involved in planning the service as he could. I'm no expert, but I said I'd go along to have my say. I found I knew more than I thought I did. I've got a better idea of how the local health service works, and this time I've had a chance to say how the appointment system could work better. I'm starting to feel like the health service belongs to me now.
When my gran had a stroke last year, she wasn't able to get up and down the stairs. She really didn't want to move house away from her family and friends, but something had to be done. The house and service arranged for a shower to be put in downstairs. All the services worked together, the occupational therapist, the application for a grant, the plumber, and the work got done. She's so relieved at being able to keep her independence.
The integration of health and social care is a great opportunity. It's a chance for us to involve people as partners in their own care, make better use of community resources, and to promote recovery and resilience through access to the right kind of support. Most of all, it is the perfect time to ensure that our health and social care services are fit for the future.
Please hang up and try again.